Hello and welcome to another video. My name is Preethika and I'm a new grad pediatric ICU nurse. If you're new to my channel, welcome. In my last video, I talked about my journey to nursing, why I made this channel, why I decided to become a nurse. So if you're curious about any of that, please check out my last video. I will link it somewhere on this screen. But in today's video, we're going to be talking about why, out of all the amazing specialties out there, I picked the Pediatric ICU for my new grad residency right out of nursing school. So just a breakdown of what to expect in this video. We'll start by talking about where I was mentally going into the nurse residency application process. I'll tell you what specialties I ended up applying to, which ones I got, and then how I narrowed it down and ultimately decided on the PICU for nurse residency. More than anything, I hope that this video can be a source of reassurance for, I'm sure I wasn't the only one, but the many nursing students out there who maybe don't feel a super strong passion for a specialty at the end of nursing school. I was very undecided, and my decision to go into critical care was more of a reflection on my personality and what exactly I wanted out of my career, more than, oh, I'm so passionate about this. And that's okay. Like, I do think my decision to go into critical care was intentional and a little bit strategic in terms of my long-term career goals. So I'm just going to talk you through that whole process. After going through all of my different nursing school rotations, I realized that there were a few things I really needed in my job in order to be satisfied and happy with it. The first, I realized that I really don't like sitting still at work. I like to be kept busy and I like to feel like I'm being challenged and I'm learning. And based on all the rotations I had, I realized that something in critical care would probably be the best fit for me. But there are so many options in critical care. You can do some type of ICU nursing, which there are so many. You could do emergency department or ER nursing. You could go into labor and delivery and specialize in women's health. And there are just so many things out there. So narrowing down to critical care was definitely a step in the right direction, but I needed to narrow it down further. After deciding on critical care, I did what most people do. I started Googling and YouTubing sporadically, trying to find more information about what it was actually like to work in these different specialties. And I also talked to a lot of friends who had more nursing experience than me, and I talked to a lot of my mentors and professors at school. The two pieces of advice that really stuck with me actually came from two of my nursing school professors. The first piece of advice was, if you don't totally know what you want to do and you're not feeling a strong draw towards a certain specialty, he told me not to specialize too early, and it would be better to do something more general so that I get experience in as much as possible and then specialize from there. And that piece of advice, I think, fit my personality really well, because I've never been someone who wants or knows exactly what they want to do in 5 to 10 years. I prefer to just take it one day at a time, one step at a time, and pivot as I go. And so when he said not to specialize too early, that was really helpful because it immediately narrowed down a lot of those critical care options. This next piece of advice that I got, you might not agree with, but it really resonated with me. And it was, coming out of nursing school, you want to pick the specialty that scares you the most. That piece of advice was really helpful for me because I really did want to be challenged coming out of nursing school. In nursing school, I feel like you learn so many random sporadic things, and I didn't want to lose it. I wanted to be in a job that was going to reinforce a lot of what we'd learned and expand on what we'd learned, like a lot of the hands-on skills, like putting in NG tubes, IVs, like critical thinking. How do you put all of these symptoms that you're seeing together into a cohesive picture to see this patient and what they're experiencing? There's so much that goes into nursing, and I wanted a specialty that was going to help me really practice nursing and like practice the art of nursing. I did a lot of research at hospitals in the area that I was going to be living in after nursing school, and found 4 jobs that really interested me, and they were the 4 jobs that I applied to. The first was a general adult ICU. The second was a general pediatric ICU. The third was a pediatric cardiac ICU. And the fourth was an adult labor and delivery unit. So I applied to all those jobs and I ended up getting all of them. So the next step was figuring out how to narrow down which one I wanted to do the most. I can make a separate video about this later, about what questions you should ask during your interview, but a component that they often include in the interview process is a tour of the unit. Like, you'll sometimes have an opportunity to shadow a nurse on the floor or spend time on the floor so you can see what the work culture is like and what the work is like. And some of my interviews ended up offering that, and that was a really big part of how I picked which specialty I wanted. Right off the bat though, I ended up deciding against the Pediatric Cardiac ICU and labor and delivery. I loved both of the units and I really enjoyed the people I talked to, but I felt like it was just too specialized right now, and maybe down the line I'll pivot that way, but as of now I felt like it just might not be the best fit. So that left me deciding between the general adult ICU and the general pediatric ICU. It wasn't a super hard decision from this point forward because I had a few clear reasons as to why pediatrics might be a better fit for me than adults. The first reason, in nursing school, I really loved my pediatrics lecture class, and in rotations, I definitely found myself having a lot more fun with the pediatric population versus the adult population. I think that just comes down to personality, like which patient populations speak to you the most, but just from that alone, I was already kind of leaning towards the pediatric ICU. But another reason, this might just be a little surface level, but bear with me, it's not talked about a lot, but there's a lot of physical labor and just manual labor that goes into being a nurse. You're moving your patients a lot, whether that's shifting their weight from side to side to prevent pressure injuries, or moving them from one bed to another for CT scans and MRIs, or maybe they're trying to walk to the bathroom or you need to take them on a walk around the unit. You're the one that's kind of holding them up and supporting them. All of that is like a type of physical labor and just work that goes along with being a nurse. And I experienced both of those things during my nursing school rotations, and as someone who is very small, it was definitely easier for me to do that with pediatric patients. Just from that alone too, I was like, I just think kids are a better fit for me right now. The third reason, which is very dependent on where you're applying and the units you're looking at, but kind of like I mentioned earlier, when you have the opportunity to go and tour units and like see what the work environment is like, I just found the work environment to be a little better and just more supportive at pediatric hospitals. That was just my experience. That's not guaranteed to be your experience too, but just in terms of work culture, I really enjoyed the pediatric hospitals. And all of that combined, I ended up deciding to go the pediatric ICU route. And how do I feel about it today? I really love my job. There are days that are rough, don't get me wrong, but overall it gives me everything that I was looking for in the first job out of nursing school. I feel challenged every time I step into the hospital. I'm surrounded by amazing mentors who are constantly teaching me new things, and I get to support and just be there for some of the most amazing patients and families, and I just find the work really rewarding too. So I think it was the best decision for me at this point in my career, and I don't see myself leaving anytime soon. Part of me always felt like by not having a passion for a specialty, that made me maybe not passionate about nursing, and that's not the case at all. Like, I love nursing, I love being a nurse. It just came down to like what environment I wanted to be in. So is the pediatric ICU right for you? I think that question comes down to a few different things, and it's not really a cookie cutter answer. Aside from just liking pediatrics and critical care in general, I think it helps if you're detail-oriented, hardworking, and if you're really looking for a job that's going to push you outside of your comfort zone. I think any ICU could be the right fit for you. My advice though is really ask during your interview what the work culture is like, whether there's a good supportive environment among the nurses there, whether you have educational resources and programs that are going to help you learn the knowledge and skills that you need to know in order to care for these really sick patients. And if you can, like, tour the unit, see if you can spend time with the nurse on the unit and really just ask all these questions. Aside from the work itself, I think the work culture, the people you work with, and especially is the leadership gonna stand up for you and like be there for you in the ways that you need. Those are all really important things to consider when picking a unit. It's not really just about specialty. So that's just my 2 cents. I know it's not totally about the PICU, but hopefully it can help you navigate the application process a little better. But yes, that's kind of why I ended up in the PICU and how I feel about it now. If you have any questions, please leave them in the comments below, and I would be more than happy to answer and just tell you what I think. But I hope you liked this video and I hope it was helpful, and until next time.